every metal structure exposed to the elements. When this lead coating is sanded, cut through, or in any other way disturbed, fine lead particles are released into the air. These particles released during these operations quickly settle on any object or surface they contact, including your clothes, skin, hair, and anything reachable by air currents. This newly created coat of lead can then be lifted off of structures by human sweat and be re-released as airborne particles when disturbed by removing protective clothing. This ability of lead to stick to itself and spread is what makes it so easy to bring lead contamination off the work site. Your employer has taken steps to protect you from lead exposure. This video is part of a safety program designed to reduce your exposure to lead and protect you and your family from lead hazards. You will learn about safe exposure levels, exposure monitoring, protective equipment, and engineering controls. You will also learn about medical surveillance, one of the most important ways of protecting your health and your family. Lead exposure is serious. Treat it with respect. Protecting yourself from lead on the job is so important because you're not only protecting yourself, but the people around you, your family. Children are especially sensitive to lead since their minds and bodies are still developing. In children, lead can cause learning disorders and other developmental problems. In larger doses, lead threatens children with illness and even death. But lead poses other threats to families as well. In addition to being carried home to children, it can affect the reproductive systems of both men and women. In men, lead can alter the structure of sperm, leading to a higher risk of birth defects. In women, even indirect exposure to lead increases the risk of stillbirths and miscarriages. Women who work directly with lead may suffer decreased fertility and abnormal menstrual cycles. Unborn babies may also be affected because lead can be absorbed through the placenta. The symptoms of lead exposure aren't easy to spot. Many times, the victim seems to be suffering from the flu or simple fatigue. Early symptoms of lead poisoning to watch for include loss of appetite, a metallic taste in the mouth, constipation, muscle and joint pain, and stomach cramps. As lead builds up in your body, it disrupts your blood's ability to carry oxygen. This can result in a disease called anemia, which is a lack of oxygen in the blood and causes persistent fatigue. Your nervous system is affected by lead exposure as well, causing numbness, slowness, and intense irritability. Lead can also build up in your bones, where your blood cells are produced. Under the influence of lead, your bone marrow can turn out immature blood cells, causing even more harm to the rest of your body. Your kidneys are also targets of lead poisoning. Lead buildup can cause severe damage to your kidneys, and symptoms often don't appear until the damage has advanced. If you experience any of these symptoms or are concerned, notify your supervisor immediately. If lead exposure is likely in your workplace, your employer is required to make an initial exposure assessment. For an initial assessment, air samples representing an entire shift are collected in each work area. The samples are analyzed to determine the concentration of lead particles. Until the results of the initial monitoring are known, certain jobs, presumed exposure tasks, are treated as if they expose you to lead above the allowable limits. These jobs include working in an area where lead coatings or paint are present, demolishing structures with lead in them, manually scraping or sanding lead paint, using a heat gun or cleaning power tools with dust collection systems, or spray painting with lead paint. For some jobs, pre-assessment protection is at an even higher level until testing proves otherwise. You must be protected against exposures of 500 micrograms per cubic meter if you are using lead-containing mortar, lead burning, working in an area where lead coatings or paint are present, rivet busting, cleaning power tools without dust collection systems, cleaning up where dry expendable abrasives are used, and moving or removing abrasive blasting enclosures. And you must be given protection against levels of 2,500 micrograms per cubic meter if you're working in jobs which include abrasive blasting, welding, cutting, and torch burning. If the initial exposure assessment shows these jobs create lower levels than the limits just mentioned, you must be provided with the level of protection that is appropriate. The permissible exposure limit, or PEL, for lead is 50 micrograms per cubic meter over an 8-hour period. If you are exposed to lead for more than 8 hours, your overall exposure is calculated by the following formula. The permissible number of micrograms per cubic meter equals 400 divided by the number of hours of exposure. Another exposure limit is the action level. The action level is used as a warning that lead levels are approaching the PEL. The action level is set at 30 micrograms per cubic meter. If the initial assessment reveals that lead concentrations are at or above the action level, but not above the PEL, your employer must begin monitoring the area at least every 6 months. If the initial testing shows levels above the PEL, your employer must begin testing quarterly. If any test shows lead concentrations in the air to be above the PEL, your employer must take steps to reduce your exposure. Wherever possible, engineering controls will be put in place. Engineering controls include restricted work areas, ventilation, and special tools which collect any dust that they create. If engineering controls are not enough to reduce levels below the PEL, you must use personal protective equipment, or PPE. All respirators should be approved by the Mine Safety and Health Administration, MSHA, and by the National Institute for Occupational Safety and Health, NIOSH. Make sure the NIOSH MSHA label is either on the respirator's container or the respirator itself. Be sure air purifying respirators are equipped with high-efficiency particulate air, HEPA, or combination filters which include HEPA filters. These filters are 99.97% efficient in trapping particles larger than 0.3 of a micron. When you get your respirator, make sure it fits properly against your face. Comfort is just as important as a good seal. When using a negative pressure respirator, cover the intake with your hand and try to breathe in. A proper seal means that no air will enter the respirator from the facepiece with the intake covered. Next, cover the exhaust and try to exhale gently. Again, a proper seal will prevent any air from leaving the respirator when the exhaust is covered. Remember, an ill-fitting respirator can expose you to dangerous amounts of lead in minutes. If you have trouble breathing with a respirator, alert your supervisor. Change your respirator filters whenever you notice an increase in breathing resistance. And to prevent skin irritation, wash your face and respirator face piece whenever you feel irritation and after every shift. A comprehensive respirator program must be provided by your employer based on OSHA's Respiratory Protection Standard. Your employer must also provide you with protective coveralls, gloves, hats, shoes, eye, and hearing protection. If you notice a problem or defect with the clothing provided, notify your supervisors. When you finish for the day, remove the protective clothing only in the change area provided for you. Your street clothes should be in a protected and separate area. Place all contaminated clothing in the containers provided. Make sure the container is labeled for lead-contaminated clothing. When removing contaminated clothing, do not try to clean it by blowing or shaking it. This will simply release lead dust into the air. One of your main goals is to prevent lead dust from becoming airborne. One of the best ways to do this is through good housekeeping practices. Vacuuming is the easiest way to clean up. Be sure to use only HEPA-filtered vacuum cleaners and empty them carefully to keep the lead dust from going back into the work area. If you cannot vacuum, you may carefully use a shovel or a broom to remove lead dust and contaminated debris. If possible, wet the area first to keep the dust from going back into the air. Do not use compressed air to blow dust off of surfaces unless you have ventilation that will capture the dust once it is airborne. To reduce your chances of swallowing or inhaling lead, you're not permitted to eat, drink, smoke, chew gum, or apply cosmetics in work areas. Your employer will provide clean break areas for you. Keep them clean and free from contamination by carefully washing your hands and face before entering. Remember to wash your hands and face at the end of each shift as well. When you're provided with a shower, use it. One of the most important parts of your employer's lead safety program is medical surveillance. While exposure monitoring keeps track of airborne lead, medical surveillance makes sure that lead inside your body remains at safe levels. You must be offered initial medical monitoring if you are or may be exposed to lead at or above the action level on any day, or will be doing any of the established presumed exposure tasks. Medical surveillance at this level includes biological monitoring in the form of blood sampling and analysis for lead and zinc protoporphyrin levels. If you're exposed to lead at or above the action level for more than a total of 30 days in any consecutive 12-month period, you must be offered an opportunity to participate in a medical surveillance program. The medical surveillance program is carried out at no cost to you. The results are kept confidential and are restricted to analysis for lead exposure. Under the medical surveillance program, you will get blood tests every 2 months for the first 6 months of your exposure and every 6 months thereafter. If your blood lead level reaches 40 micrograms per tenth of a liter, also known as a deciliter, you will receive a blood lead test every 2 months. You will continue getting tests every 2 months until 2 consecutive tests show that the level has dropped below 40 micrograms per deciliter. If your level is micrograms per deciliter, you will also be notified that an elevated blood lead level requires medical removal with medical removal benefits. If testing shows a blood lead level that exceeds the amount needed for mandatory medical removal, 50 micrograms per deciliter, you will receive a follow-up test within 2 weeks after the results of the first test. If this follow-up test shows a level of 50 micrograms per deciliter, you will be removed from work. If you have been removed, you will need to be retested at least monthly during the removal period. Removal from lead exposure need not be final. Once an examination shows that the risk to your health has passed, you may return to the job from which you were removed. Any limitations placed on you because of your health will also be removed as soon as you get final medical approval. If you're removed from lead exposure due to medical findings, your seniority and other job benefits will be protected for up to 18 months, provided the job from which you were removed continues. This protection begins every time you're medically removed from lead work. Whatever the results of your test, you will always be notified in writing of your blood lead level. In addition, you will receive an annual medical exam to head off any of the harmful effects of lead exposure. Remember, if you are eligible, request an exam as soon as possible if you develop any symptoms of lead poisoning. If you want to know whether or not your lead exposure has affected your ability to have healthy children, if you are pregnant, or if you have trouble breathing during a respirator fit test or during respirator use. If the examining doctor finds any conditions not related to your lead exposure, you will be notified personally. The only results your employer may be notified about are discovery of a condition that could increase your health risk from exposure to lead, any protective measures necessary to decrease your risk, limitation of your use of respirators, and results of blood lead tests. In some cases, drugs known as chelating agents can reduce the levels of lead absorbed in the body. Because of their harmful side effects, though, their use as a preventative measure is prohibited. Chelation is only allowed under clinical supervision and with the full knowledge of the employee. Lead health hazards can go far beyond the workplace. If you're not careful, lead can reach into your home, affecting your family's health and safety. So remember to protect yourself with knowledge of the hazards of lead exposure and how to reduce them.